Hello, my name is James Cook. I'm with the University of Maine at Augusta, and I'm recording this video to talk about the data that is available from the United States government to talk about one aspect of the substance abuse social problem facing this country. So that's a mouthful. Substance abuse regards alcohol and other psychoactive substances that lead to dependence and addiction, and the United States government's building of a social consensus that these are a problem needing some kind of resolution. And so the resolution that has been worked out varies. It has a number of different aspects. Some of them are legal in terms of criminal sanctions. You can end up in jail. There's been a lot of controversy regarding that. A second is a medical model of solution in which individuals go in for treatment. And treatment centers are therefore seen as an alternative to criminalization, right? You can have two different kinds of policies that apply. But a really good question is that if treatment centers are being supported through government funds, which come from taxpayers eventually, then how well are they working? In order to figure that out, there have been a series of laws that have been passed which have led to a data set called TEDS. TEDS is an acronym and it stands for the Treatment Episode Dataset. It's maintained by SAMHSA, which is itself an acronym for the Substance Abuse and Mental Health Services Administration. So the treatment episode dataset is not a study directly of people, but of particular events that happen and then subsequent events that happen regarding people. And the case is an admission. So when somebody is admitted to a substance abuse treatment center, they are entered into the system as a case, which means that they are in a data set. They get a row. And if one person is admitted more than once, they get more than one row. If a person is never admitted for treatment for substance abuse order at an addiction treatment facility, then they never are entered into the TEDS data set. So this is a data set specifically about what happens and who happens upon these treatment facilities. An additional featured in notice of the TEDS data set is that it only includes admission to treatment facilities that receive state or federal funds from alcohol and drug agencies, of which there are many. And most public and many nonprofit private treatment facilities do receive these federal funds, but there are private treatment facilities that do not receive federal or state government funds to support them, and therefore they would not be included in this data set. So this data set is publicly available. It's publicly available for a number of years, and you can find out information about admissions and then discharges of the same people. You can find out aspects of their past behavior, aspects of their medical insurance, how long they waited to get in, all kinds of really interesting things to observe in the TEDS dataset. So what I'd like to focus on is a little bit about how to get your access to the TEDS dataset. And the first thing you need to do in order to really get information from the TEDS dataset is that you have to understand what all the variables there mean. And If you're only interested in understanding one variable, you would want to figure out what kind of pattern there is just for one kind of source of information. So let's talk about code books first. Code books, by definition, are documents. They're not always literal books, but they can be electronic documents as well, that contain the definition of variables that are collected, where a variable is a characteristic of something, right? So I have the characteristic of the color of my shirt. It's black. That's a variable. And the value of the variable color is black. Someone else could have a blue shirt, so the value of their variable shirt color would be blue. You would have different variables that would be collected regarding admissions to drug abuse treatment centers, drug and alcohol abuse treatment centers. And those would include, like I said before, characteristics like what is their insurance level? What is their primary amount of payment? What is the primary substance use issue that is leading them there? What are the secondary substance use issues that are there? What was the date that they got admitted? You need to know that if you want to track changes over time, and on and on and on, right down to the level of education, their gender. These are all included in TEDS. But in order to figure out exactly what variable is measuring what, you need a code book. The TEDS code book will tell you not only what the definition is, but it will give you a list of all the possible values that the variable can take. And then, in a really handy step, the TEDS codebooks have frequency distributions for each variable. Frequency distribution sounds very fancy, but all it means is how many observations of each particular value of a variable there are. For instance, if you went out and you got a data set that was of 100 people and they all had shirts on and you looked at their color, how many shirts were black, how many were blue, how many were yellow, how many were pink, how many were red. The TEDS code book has this information, has the frequency, how many, distribution, how many of each kind of characteristic. But it's of much more important information if you care about alcohol and drug abuse. And we can take a look at that code book for a moment by going to the SAMHSA.gov website. It has many particular sub-websites, but if you go to www.dasis.samhsa.gov, you will be taken eventually to this page, which has a lot of links. It has actual reports that are describing highlights for each year. You'll notice they're going all the way back to 1997. So this is like 20 years or more of data. The last available year is for 2017, but then if you keep going down, you'll see under public use files, documentation codebook for each year, going in this case all the way back to 1992, 25 years of data, and then you could click on codebook and it'll take you to a PDF file that anyone can read. Now, it's going to tell you a lot of information. Up front, it's going to have a preface that's going to tell you all kinds of things about what the TEDS data set is, where it came from. This is really neat stuff. What the basic 19 variables are that are collected by every involved treatment center and sent on to this website. Think about that. All across the country, all these treatment centers, what the limitations of the data are, and so on and so forth. And then on page 7, you get to the real beautiful part, the variable descriptions and their frequencies. So case identification number is the first one, right? And it's not going to be very interesting. Let's make this a bit bigger so you can see it. It says everybody gets a unique case ID. Okay, so we move on to the next page. Each variable gets its own page. Next variable, not so interesting. Admyr, A-D-M-Y-R. You wouldn't know what it was if it wasn't for a code book to tell you, oh, that's a year of admission. And in 2017, the year of admission was always 2017. This variable has only one value. And yet, even this basic information gives you something important. A frequency, 2,005,395 admissions. That's how many admissions there were to these federally and state-funded treatment centers. More than 2 million. Now you could compare that to other years to see are the number of admissions increasing, are they decreasing? You could use that to describe the extent of this social problem. Here's something interesting. You could find the variable age of admission. How old is someone? And now here we get a series of values, right? And the categories, the values are, if you look at the label, it'll say, well, 12 to 14 years old. That's a 3-year stretch. Some of the other stretches are 5 years, like the value 30 to 34 years. That's 30, 31, 32, 33, 34. That's a stretch of 5 years. And then there's the biggest one of all, 65 years and older. That could go all the way up to more than 100 years old. And yet, only, we find out from the frequency distribution here, only 1.2% of those who are admitted are 65 years of age and older. Only 24,213 out of the more than 2 million. On the other hand, if you look at a much smaller set of years, the 5-year span of 25 to 29, you find the largest frequency, 361,722. So you can keep going and you can keep finding out information like, here's something interesting. We know that the relative presence of men and women in our society, males and females, biologic sex, it's mislabeled gender, is roughly 51% female, roughly 49% male, and we know that there are people who are intersex and who are non-binary as well. However, and that's somewhat reflected here in this third value, it's interesting that the admissions here are overwhelmingly male, disproportionately male. That is, the percentage of admissions, 64.4% male, is larger than the frequency of males in the population. That tells us something really important. Is it that males are more likely to become addicted, or is it that males are more likely to become admitted? Here we only can know that males are more likely to be admitted than females for treatment. We don't know about levels of addiction because some kinds of addiction can be hidden, but we do know something about admissions, and that is an interesting fact that you've just found out by just looking at the code book. We can take information on age and we can do the same thing. We can say, well, sure, 18% of those admitted were 25 to 29 years of age, but how does that compare to how many people there were in the population during that year? Well, we can go look at the US Census Bureau's data, or we can have it created in a graphic form by populationpyramid.net, a really great website. And so we have on the right that information, 25 to 29 years of age. Now, unfortunately, the graphic, it has text that is too small, so I'm going to have to read this to you, which is something that we try to avoid when we're doing presentations. But males are 3.6%, females are 3.4%. Together, that makes 7% of the population being 25 to 29 years of age when in 2017, where in the United States of America. So just 7% of the population, but 18% of the population is 25 to 29 years of age, of those who are admitted to drug treatment centers, right? So that is more than twice as many as we would expect, about 2.5 times as many as we would expect by chance alone. So if you are interested in uncovering these kinds of patterns, you can look at the Codebook for TEDS data. And there are also two ways that you can look at more than one variable at once. For instance, does the biologic sex that is measured of individuals, and we noticed there were some individuals who didn't fit in that binary, does that relate to age? We know that individuals who are identified as male are more likely to be admitted than those who identify as female, knowing the general distribution in the population of maleness versus femaleness. But we can also ask, do those who are males tend to get admitted at an older age or a younger age than those who identify as females? So that's a bivariate relationship in which you have one variable that's called a dependent variable, which has an outcome, and another variable, which is an independent variable, which is supposed to be affecting somehow that dependent variable. And you wonder how. How do they interact with one another? How does one variable affect another? So you could look at the public data analysis system at pdas.samhsa.gov, samhsa.gov, and that will allow you to actually create charts that show how the typical age of those who are admitted varies by, say, sex. If you are interested in downloading the entire data in which you can actually see individual people with their names taken out, with all identifying information taken out, no addresses, no social security numbers, no birth dates, although they do talk about the age categories of each person, you can do that. That's at www.dasis.samhsa.gov. The advantage of that is that you can look at each case and you can see for each case how two kinds of characteristics, like their age and their sex, vary together. On the other hand, the disadvantage is that these are very large files. Your computer should have a large hard drive if you want to download them, and it should have a lot of memory to be able to look through them. But if you wanted to, you could. And if you were able to look at this information, you might be able to come up with some new observations about drug treatment in the United States, drug and alcohol treatment, that maybe nobody else has ever come up with before. And you could change the way people think about substance abuse and the treatment of substance abuse as a resolution to a social problem. You could help change the country. And if you're interested, you could help change it for the better.